I'm now going to explain to you how to use cervical overhead door traction. A box that you will be given will have these items. This is the bag that will hold the water, and you will see on the bag that there are different lines that represent poundage. We will most likely be using somewhere in the range of 8 to 12 pounds of water, and so you would simply fill the bag up to that level and then close the cap on the bag. This is the part of the device that will go over the top of the door, and it will hang over the door in this manner. We'll attach it to the top of the door later, and then the traction unit itself will attach to this portion of the device. This is the portion of the traction unit that will actually attach to this item that fastens to the door. The way that it's attached is by the bottom portion going in this hole. The top portion is squeezed and then goes into this opening. As a locking device, you start by turning it sideways like this and then rotating it, and that allows a small little lever that is on this round piece to lock so it won't come out. You then squeeze this together and place it into the hole so it will sit on the door like this. These pulleys are items that you put on before you actually fasten it to this latch. Then you'll simply open your door, place this on top of the door, and it will sit up like this. These doors are taller than the doors that you'll probably have at home, and so the ones that you have at home will most likely be at this height, and you'll traction from that point. This is the portion that contains the rope and the halter bracket. The rope will be undone, and you'll see that as we go through the actual traction itself. And so you would then simply thread the rope through the traction pulley like this, and then through the other portion of the pulley in this manner. And it will then attach this portion to the water bag on the little metal hook that is right here. So then when the traction unit is actually set up, you'll have the water bag attached and the halter portion attached as well. I will now show the actual traction unit set up on the door. Just as a rule of thumb, remember that the harness portion will go away from the door. So you'll want the portion of the rope that attaches to the harness to go down from the front pulley, and the second pulley will be the one that holds the water bag. And so it will be hanging in this position. We will now go in and take a close look at the setup of the traction unit itself when it is on the door. This will be similar to what you will find at home. It will be attached to the top of the door like this. The pulleys will be horizontal on the bottom bar. The rope will be fastened through this, and then the harness and bag will be suspended. You'll notice that the harness is actually on the front pulley, and the bag is suspended from the back pulley. You will notice that the head harness is now suspended from the harnessed bracket. You'll see that I have the brackets on the second notch from each side. you could put it on the first notch or on the third notch in. It depends on the comfort level you feel having the harness around your ears. This is what the traction unit should look like from the back. You will notice that I'm sitting upright in a back supported chair. The angle of the rope is slightly toward the door so that my head will be in slight flexion like this, rather than being underneath where it will have a tendency to pull it backward. I want to increase the amount of pull on the back of my head so that I don't take all of the pull from my chin area. I'll turn around now and show you what it would be like if I were to face you. However, when doing the traction, generally we would have you face the door with a slight angle in the rope away from the door so that your head will be in slight flexion rather than straight under this bracket. Okay, now I'm facing you with the traction unit. You'll see how if you look at the bracket, I've gone onto this portion, the second notch in. You could just as easily put it on the first notch or inward on the third notch. It depends on how comfortable you are with this portion of the harness across your ears. If you want more width, then you would put it on the outside. Generally, I would tend to put it on the second notch. Also, you want to have these fastened equally and have it so it is comfortably but firmly around your chin. And the reason that we will have you face the door is that you'll notice that when I sit like this, I'm not at an angle away from the door, and so my traction tends to be like this rather than pulling from the back of the neck, which is not quite as comfortable and it is not as effective in the traction of your neck. But I'm turning around so that you can at least see how the harness is placed on my head. Now normally when you're going to do the traction, you'll be facing the door. You would have the water bag sitting on your lap so that you can comfortably place the harness on your head. Once you've placed the harness on your head, then you would simply release the water bag slowly by holding onto the rope and let it down so that you don't suddenly jerk your neck. Obviously I can't do that because I'm facing you at this time. But if I were turned around, that's how I would put this harness on. Sometimes people will find it easier to put the harness on when there's a little bit of pull on the rope, and so they'll have a tendency to let the water bag hang and put it on. I find it easier to have the water bag on my lap, get the harness fastened, and then slowly place the bag down, and then I can make some other little adjustments in this strap to make it comfortable and feel like it is firmly and evenly on my head. And then you want to make sure you're sitting back in the chair, resting your arms on your lap, and allow yourself to sit in traction for the amount of time the doctor has stated. When you're done with the traction, you'll simply take the water bag by the rope, place the water bag on your lap, which will take this tension off of this rope here, and then you can undo the harness, take it off of your chin, and it will allow you then to get out of the traction itself. Remember, when doing this traction, as with all exercises or activities that we give you, you should not force through pain. If it hurts, if you find significant increase in your symptoms, please stop and wait until you've talked with the doctor before continuing. Don't force through pain. Stop if it hurts.